Nigeria's Minister of Health, Isaac Adewale, has directed heads of federal government hospitals to ensure that all other medical doctors are available to fill the vacuum created by the striking National Association of Resident Doctors. These include consultants and even youth corps doctors, as well as doctors on internship. Resident doctors started a total and indefinite industrial action on Monday in order to get the government to agree to a list of demands. They want an immediate payment of salary shortfalls experienced between January and May this year. They are also asking the government to stop its plan to stall the promotion of resident doctors. The strike could cripple services at the hospitals, but the minister says his directive ensures that the provision of health services continue.
Now, the chairman of the Lagos chapter of the Nigerian Medical Association, Dr. Olubunmi Omojolowo, joins us now on the News Hour for more on this. Many thanks for joining us on TVC News Hour. Day 2 of your strike, how's it been so far?
Well, thank you very much. The strike is going on. The strike is effective. Unfortunately, this is not where we are supposed to be, but majorly affecting the federal hospitals. Yeah.
You know, my concern is, why did you choose now when you know that the federal government is already grappling with another industrial action?
Okay, thank you very much. You see, most of the issues at hand, they are not new. They have lingered on for so long, minimum of 3 years, some more than 3 years. And it shows that if the government has been genuine and serious about this thing, these matters will have been resolved before now. So I think the resident doctors have a lot of grievances and they have a lot of demands, but they have encapsulated into 5 or 6 demands, which I think they are reasonable demands that can be met within a short period of time if we are really serious about meeting those demands. So I don't see any reason why the government should not be able to pay them arrears of salary, why they should not pay their salary that have not been paid.
There, you know, so part of them, but the government released a statement today coming from the Minister of Labour. You've seen the statement expressing its disappointment of why there was an agreement and you people just turn around and say no more agreement. And the minister, according to the Labour, the Dispute Act says, okay, he's apprehending the strike. What does that mean for you? Well,
let me say that, you see, I'm sure the government, they should understand the modus operandi of NAD, that's the National Association of Resident Doctors. Now, irrespective of whatever agreement the leadership of the association has signed with government, they still have to take it back to their colleagues in terms of the Congress or emergency meeting, which they actually did on Monday, which was a public holiday, to show you that they are also eager to resolve this matter. And overwhelmingly, people were not impressed with the so-called MOU or agreement because it has happened several times. You know, we are tired of MOU. Just do what is expected rather than sign the MOU. I think these MOUs, most of the time, are just crafty ways by which the government try to evade some of these things that they are supposed to do.
Yeah, but so, if what the minister says subsists, if he apprehends this strike according to the Dispute Act, which is in order, what would that mean? Getting a conciliator, getting a mediator, getting a board, how would that help your matter?
Well, I don't know the technicalities, but if the government is serious, they should continue in this way of dialoguing with the doctors. I'm aware that tomorrow there's another meeting that the federal government has fixed with the resident doctors. And I believe that it's an avenue to resolve the matter. And the resident doctors are willing. They have also called all these chapters of doctors to come to Abuja to resolve the matter. So I don't think anybody should grandstand. You see, the issue at stake is about welfare of doctors. And I think the government and the society is not being fair on doctors.
Well, are you looking at the plight of patients? For instance, the chief medical doctor of Luth, what's his name now, Professor Chris Bode,
yes.
He is wearing a human face. He has said that there are no plans for patients to be discharged from the hospital. How will they then be treated when doctors are on strike?
Well, thank you very much. I think all doctors have human face, and we are trained to take care of our patients. However, you see, people usually talk about this Hippocratic Code, that Hippocratic Code. Most people have not even seen this Hippocratic Code, don't know what is inside it. It's an holistic document the government, the society has a responsibility in that document, as well as the doctor also have their own responsibility. When the government or the society renege on their own part, then it's not fair for you to expect the doctor to continue to perform.
According to the Labour Act. According to the Labour Act, you're meant to pay, yes. That's what the Labour Act says, yes.
You have not been paid. How can you, as a hungry doctor, you cannot be effective? So I think the society has to be fair on the doctors. And that is why we are losing so many Nigerian doctors. On the average, every year, we have about 3,000 doctors leaving the shores of Nigeria.
What about the call for doctors on housemanship not to join in the strike? Can you explain that to us?
Well, that is a gray area. You see, presently, the consultants are working.
Yeah.
Then the NYC doctors, as the health ministers have said, they are working. So there is a form of skeletal service still going on. So you cannot say that the hospital is shut down completely.
We are wrapping up now, yeah. But are you confident that the NYC doctors can hold their own?
Of course, it's not possible for them to hold their own because the volume and the nature of the job, they can just be a stopgap measure. They cannot be able to fill in the gap for the resident doctors, because resident doctors form the bulk of the doctors in the hospital, and they are specialists in training. Okay. So you cannot compare them with NYC doctors. Yeah.
Dr. Olubunmi Omojolowo, Chairman, Nigerian Medical Association, the Lagos chapter. Thank you for being with us here.
Thank you very much.